And if you don't believe that, then go to Canada and sit in line like my father-in-law did this past winter when he went in about 9 in the morning and he got home about 7 at night to get treated for bronchitis. The waiting rooms were that long, and that's just their healthcare system. If you don't have anything urgent, you'll survive. But if you do, you come to the United States to get treatment sooner or when you need it. And so I think this whole healthcare issue is really at a pivotal point. And you know, I think we either drive off a cliff at some point in our nation with this debt crisis and government taking over, or we as citizens have to step up and take on some of these responsibilities. But healthcare, the long-term care is one of the things. Planning, how do we do that? You know, one of the other things we have done, and I think it's a bit of an example of what we probably need more in our healthcare arena. Sometimes we stymie competition. We actually have laws that don't allow hospitals to open up unless the state approves a new license for a new hospital to add so many beds. I mean, what part of competition don't we understand when we put laws in place like that? We restrict how many doctors can get through higher education facilities and how many nurses can, because then we can artificially keep the marketplace short of supply of physicians and healthcare treatment workers. And you know, that all drives costs. And so, and then we remove the consumer just about completely from paying for any of these healthcare costs. And U.S. tri-state manufacturers, I know, have worked on different ones of you that belong to this group have started doing HSAs, which we put into law about 6-8 years ago. And I'd be interested in some feedback. But what I have been hearing is that it has been a good solution, and the more we can set up a system where the consumer does more shopping and has discretion over where they get the healthcare procedure done and what they spend their money on with an HSA and a high deductible insurance. Those are examples that I think we have to look at because you can't remove the consumer from any decisions in shopping. You can't constrict and restrict the supply of workers in the healthcare fields and the number of facilities, and then expect and then wonder why costs keep going through the roof. And then you know, this whole government experiment that we're about ready to embark upon, I don't think is going to be something my children are going to be benefited from when this thing fully takes effect. But it's hard to turn back once we get over the cliff, if you will. And so some of that, some of that deals with the long-term care insurance. Back to your question, we have to do more with tax credits, but also we've done some more to facilitate and promote assisted living and more senior foster care places with residents where it costs less. And one of the things I have been a proponent of and will continue is they always want to keep regulating the assisted living units that we've seen in the last 10, 15 years come up, just like nursing homes. And
we need to keep moving because I got lots. We got lots.
All right, good.
Mary, did you have a...
Yes, I do. And Tori did a great job of covering just about everything that I'd like to say. But nursing homes, because of the laws in Minnesota, it's called rate equalization. The law says that the state cannot, or the nursing homes cannot charge private pay residents more than what the state is reimbursing. So the true cost of care is not being able to being paid out. So the nursing homes, I know Canute Nelson Alexandria is losing about $20-some a day per private pay resident. They make that money up now in their other facilities, but those other facilities are floating our nursing home over there.
Ouch.
And so that the care center is losing money. And when Tori Westrom talked about welcome to government-run healthcare. That's exactly what's going to happen. There's only so much money going around. And then you talk about staffing the nursing home. It's not just RNs and LPNs, but our certified nursing assistants also are not making a lot of money for the work that they do. And our nursing homes are having a hard time keeping people employed there because they're not being paid the true cost of their care also.
Yes.
I'll just add that your question about the credit, I think the credit will continue. We need to increase it, but it won't go away. I don't believe that's even on the
Okay, because that is was a concern from several people at where I work.
Sure, I think the issue is we'd like to increase that, but again, the cost of the long-term care is expensive. It's a very, I mean, it really is. So the $100 really isn't enough incentive to make a difference.
That is the comment we got back from some of our employees. Now, along the same line with healthcare, and remember, we need to keep our answers somewhat short here. There's the impending burden of Medicare due to the aging population. Part of it, everyone has alluded to, is rules. What comes to mind is the hospital that was built a few years ago just west of Brainerd. It was put out in the country because you get better reimbursement from Medicare if it's a rural facility, and the way they were building it than if they would have built it in town. And yes, it is a regional hospital, but it is out in the middle of nowhere, even though it's about 5 miles outside. I think it's on highway, whatever that highway is, it goes west of Brainerd. But the overall burden of Medicare is going to only increase. Any solutions coming for that?
What you're talking about is the critical access hospital system, because we can talk about healthcare reform, but if there are no healthcare providers in outstate Minnesota, in particular in our region, it won't make any difference what kind of insurance policy you have or what kind of exchange you belong to. So a number of years ago, the federal government instituted a critical access hospital system, and it reimburses small hospitals 100% of their Medicare cost, unlike other hospitals. So when you have someone, for example, that builds their hospital out in the middle of nowhere, they maybe are trying to fit into that system some way, which is not necessarily appropriate. Perham Hospital is a critical access hospital. You have Breckenridge Critical Access Hospital. You have the people that are not critical access hospital, Alexandria, Fergus Falls, Detroit Lakes. Brainerd is not critical access, and those folks fall into sort of a group called the tweener hospitals. They're not big enough to have the economy of scale that you have from Altru or Essentia or the Sanford system, and they're not small enough to be a critical access hospital. And so that's where it gets to be real dicey, but that critical access hospital was designed to keep health care available for people in our part of the world. Okay?
Okay. One other question that comes up is on the state level. Is there any thought to, and I believe this comes out of commerce, making it so insurance companies would cover naturopathic care, and that naturopathic care generally is not an after the fact, but it's more preventative care from the consumer's point of view. Is there any talk that anybody knows about helping your naturopaths become insurable? Not insurable from their point of view, but where insurance companies cover their care?
I don't have an answer, except that I'm concerned, I guess, when we're asking the insurance companies to provide more. We're talking about premiums. We're trying to keep the premiums down. And if we're asking them to cover more and more, and even limiting the amount of advertising, I mean, anytime we're causing the insurance companies, we're giving them another reason to raise rates. I think that'll be the end result. So there may be a lot of people that are very proponents of that, but again, I'm cautious on what in the world we're asking the insurance companies to do and still expect affordable premiums.
Yes, ma'am.
I'm a big fan of the natural pathways here, chiropractic care down to homeopathic care. But, you know, once again, opening up that insurance market so you can shop for what you want and what you need, so that if you want to go the route of natural care, then you should be able to have that as an option and pay for that without the rest of those that maybe
Yeah, because right now it's not.
You don't have that option.
But I think, to her point, and we've talked about it, opening up these healthcare insurance across state lines, I think would be a good first step in bringing more competition to the market.
Exactly.
Realistically, we've only got a few marketplace providers.
Is that conversation going on between states right now around the 5-state area?
I'll tell you what, I did have a bill for that, but here's the argument that I got, was if you do this, and if you want to propose this, you're going to have literature pieces that say Mary Franson denied coverage for somebody with breast cancer, or Mary Franson cut this, because people don't understand the whole picture, that you are shopping for what you want. I'm not saying that you're not going to have this coverage anymore. If you don't want that type of coverage built into your plan, then you don't have to do it. But it's that educating and the whole political mess behind it of that mailer's going to say that, which is very sad. And that's what politics has become, though. What's that mailer going to say if you do this?